Dear members, the vote to endorse the claim for our Public Health System Award has just concluded, and you have once again voted overwhelmingly to continue the campaign for ratios which we began in 2010. Last year, nurses and midwives campaigned strongly for the extension and improvement of ratios in our public health system. We rallied and marched in our local communities. We took political action by visiting our local Member of Parliament. We took industrial action, and we made it clear to this government that unless they took patient safety seriously, this issue would not go away. Despite our campaigning efforts last year, this government has yet to put an offer on the table that satisfies our position to keep our patients safe. To their credit, they have upheld the award that contained a legally enforceable ratio system, which was won after long battle with the previous government. But they must do more and step up to the plate and deliver safe patient care for everyone in this state, no matter the postcode. The government must improve and extend legally enforceable, mandated minimum nurse-to-patient ratios, built on nursing hours. Here's what is needed to build on our award achievements. Improve ratios in all New South Wales hospitals to the same level as Group A city hospitals. Introduce ratios in paediatric and neonatal intensive care units. Introduce ratios in emergency departments, emergency medical units and medical assessment units. Introduce ratios in intensive and critical care units. Introduce a ratios equivalent system in community and community mental health. Extend ratios to more mental health units and improve ratios in specialised mental health hospitals. In addition to this, we are also asking the government to employ additional clinical nurse educators and clinical midwifery educators, and to employ assistants in nursing only where clinically appropriate, and to replace the midnight census for nursing hours calculations with a system that accurately reflects patient numbers and provide patient specialing in addition to mandated nursing hours or ratios. You also voted for a 2.5% pay increase for July of this year. Members have made it clear that while a 2.5% pay increase without any trade-offs is acceptable, a legally enforceable award containing the necessary extensions and improvements in ratios is what is of paramount importance to us. We are still in a court battle with the government to force them to respect the Industrial Relations Commission's decisions to uphold the full 2.5% that was owed to all public sector workers, rather than the 2.27% that was paid last year. The government is refusing to pay you the full 0.5% federal increase in superannuation owed to you, and have so far disregarded 2 Industrial Relations Commission verdicts and 2 upper house votes. It beggars belief that this government would rather spend money on expensive legal proceedings than pay workers what they are owed due to their stubborn ideological belief that public sector workers and essential services are not worth the superannuation investment in you. But we will continue to battle this out in court and hopefully force the government to pay you what you are rightfully owed. An additional claim that you've strongly endorsed this year is to reduce consecutive shifts to a maximum of 6 that a nurse can be rostered to work. This is a no-cost claim that reflects common rostering practices, that 6 is enough, but more can only be worked by agreement. Fatigue is a real risk in the workplace that can be harmful for nurses, midwives and our patients. In order to protect you and your patients by reducing the risk of error and injury, we'll be including this additional claim. This will not be an easy fight to win. We know it never is when it comes to patient safety. As nursing and midwifery professionals, we have always had to be in the forefront of being advocates for our patients. But it is inspiring to see how far we have come and what we can achieve if we put our minds to it. We must continue to keep the pressure up on our local decision makers and build awareness in our local communities about ratios putting patient safety first. There are other battles as well that have put us in a position of defending our world-class public health system. The new Northern Beaches Hospital will be privatised, and we are already seeing the disability sector and mental health services being outsourced to NGOs. If the federal government gets its way by tampering with Medicare, universal and accessible healthcare will be compromised on all fronts, and we'll see a wave of privatisations that will forever change the way we deliver patient care. It won't be long before we'll have to defend the ratios we've already achieved. We know we'll have a hard year of campaigning ahead, but we are up for the fight where our patients are concerned, and we must send a clear message to this government that we will continue to fight for our patients and our industrial rights even after they are long gone.